So, there's a deadly virus outbreak on a cruise ship, and dozens of potentially exposed passengers on board are now spread around the world. Officials need to track them down, but how do they do that?
Now, we're talking about multiple jurisdictions, multiple organizations, people having traveled globally now.
That's epidemiologist Anne Rimoin. She's talking to me about a strain of the rare hantavirus that spread aboard a ship as it sailed across the Atlantic Ocean. At least 3 passengers have died and several others are sick. But the World Health Organization says the risk to the public remains low. However, tracing every possible contact has become a complex global effort as officials in 4 continents try to find dozens of passengers who disembarked from the cruise ship before the outbreak was detected and trace others who may have come into contact with them. The ship, the MV Hondius, left Argentina on April the 1st. It was scheduled to visit Antarctica and other locations, but plans changed due to the outbreak. It made its way to the island of St Helena, then Ascension Island, and finally Cape Verde. Anne Rimoin is Professor of Epidemiology and Director of the Centre for Global Health Security at the UCLA School of Public Health. Welcome to you. I'm wondering if you could begin by putting these hantavirus cases into some context for us. What would you say to people who are inevitably comparing this to COVID-19 or worried that it could turn into a situation like that?
Well, this is a very different situation. We have a virus that is a known virus that we do have information on. We have diagnostics for it. And what we know about it from the data that does exist is that person-to-person spread does happen, but it does not appear to be as significant as diseases or as viruses like the SARS-CoV-2 virus, which was extremely contagious. This virus, the Andes virus, requires much closer, sustained contact between people as we understand it. So I think that this is a very different situation. And I understand that people have a lot of anxiety about after just having experienced the pandemic, but this is a very different virus and a very different set of circumstances.
Thanks a lot for clearing that up for us. Now, you're a virus tracking expert, so let's talk a little bit more about that. When we're talking about this hantavirus, a few confirmed cases, but many more potentially exposed. How do you start tracing an outbreak like this when people potentially who are impacted are spread across continents?
Well, you start with the basics. You define the cases that you have, the confirmed cases, the probable cases, and the suspected cases, and that's all based on diagnostics. And so testing people to know whether they actually have biological evidence of having been infected or not, or having been exposed. And you establish a timeline, and that's really important here. You need to understand when people came in contact with, well, for example, for the index cases, these first cases, when did they potentially come in contact with rodents? How long was their incubation period? What were the opportunities to spread it to other people? And on a ship, that's going to mean really understanding, people where they were, how long people were in contact, were they sitting and eating together, what kind of excursions they were having, what kind of medical encounters there were, social contacts, and caregiving contacts. So you need to compile all of this information and really be able to pull all these pieces of the puzzle together to understand exactly who's had it, what the exposures were, and what the likely onward exposures could be. And then you're going to want to quarantine those people until they're through this potential period of incubation.
I want to ask you a bit more about this context of ships in just a moment, but if we can just get back to what you were saying with the timeline and these sorts of questions that need to run through in order to create the timeline. Once that's done, is it possible at all to trace everyone?
Well, here's the good news about a ship with the ship's manifest and some of the travel that was done. we're going to have a really good idea of who people came in contact with and where they were. Now, that said, we do have a timeline that probably occurred before these people got on a ship. And so we may have some difficulty constructing that piece of it. But I do think that we will have a good chance of getting the vast majority of people that were in close contact with anybody that could have potentially spread this virus, and we'll be able to follow those people pretty well. I mean, you never know if you're going to be able to get every single person, because there are always things that could fall through the crack, and you're relying on memory as well as whatever evidence you can pull together in terms of timelines and where people were. But I do think that in this particular case, given how long these people were on the ship before they were symptomatic, we are likely to have a very good timeline of exposure.
Okay, that's some good news. I want to play you a soundbite from a passenger aboard this cruise ship. We'll listen to that and come back to you in just a moment.
On 12th of April, when the first passenger passed away, we were told that that passenger passed away because of the natural causes. The captain said, we are not infectious. So we didn't isolate ourselves. We were together at dining rooms. Mostly I was trying to understand the situation, but the information was not enough.
Anne Rimoin, I played that not to point fingers or blame, because what the passenger described happened before authorities knew that a hantavirus was the culprit. But was this a missed opportunity to contain the outbreak?
Well, I mean, here's the thing about a hantavirus infection is that it often looks just like a respiratory infection. And sometimes with hantapulmonary syndrome, it can happen very abruptly and acutely. And if this individual was older, it just might have looked like some other kind of circumstance. So, until you're suspecting an infectious agent here and knowing that you're going to have to test for things, I think it's very complicated to say, well, they should have suspected something like this, because I don't think at the time and I know just about as much as you do, because I'm not working specifically on this investigation, but I'm certainly following along and reading all the information that's available. And if the wife at that time did not have respiratory symptoms, which it doesn't seem like she did, it's very, very understandable that people would have thought, this just has to do with something else.
Okay, that's fair enough. Now, I'm wondering if you could explain for the people watching what tools or data, what's relied on to track the spread of viruses, particularly one like this.
Where you're going to use all of the epidemiologic tools that you have, both kind of the standard shoe leather epidemiology that we talk about in terms of interviewing people and understanding where they've been and all of the exposures that they've had, that include other people, environmental exposures, rodent exposures, travel histories, their own medical histories to understand who may or may not be more vulnerable. And then using all of those molecular epidemiology tools like sequencing and serology and being able to and PCR. So being able to determine, has somebody been acutely infected? Did somebody have some sort of exposure that resolved without understanding that they had it? Maybe an asymptomatic or a very few symptoms that might have gone unnoticed. And then also sequencing the cases that they find the virus, so that they understand, are these cases that are all linked? Have there been any mutations to the virus that might suggest something new? Which I understand there has not been anything new here, that these samples were very, very similar to what they've seen previously with Andes virus before. So there are lots of tools available to solve this mystery.
Are there any blind spots in contact tracing?
there are always blind spots. There are always going to be blind spots in contact tracing because you can only use the information that you have. I mean, now having flight manifests and boat manifests and travel itineraries and, you know, those kinds of pieces, that's very, very helpful. But it also requires people to remember where they were and who they were in contact with and what the circumstances were. And there's always going to be some human error there. And also for the people who either are very sick and can't communicate, or those people who are deceased, you know, we may not be able to totally construct their exposures previously.
Now, as I understand, this particular strain of the hantavirus has a 6-week incubation period. Does that mean when that time's up that we could potentially be seeing more cases, and that those cases will need to be monitored wherever they are?
Sure. Well, you know, that's the thing about hantaviruses that are so complicated. They have a really long incubation period, anywhere from 6 to 8 weeks at the longest. So it can take a long time for people to become symptomatic and then become sick. And the other thing that's a little bit tricky about this virus is that it appears that people can be symptomatic during what we call the prodrome period. So just when they're starting to not feel well, maybe having a little bit of a fever and not knowing that they're sick at that point. So the good news is it takes a long time. So it means that if you identify people early, we'll be able to get those people into quarantine and keep them away from other people so that they don't have the chance to be able to spread it onward. But, you know, in this case where it was finally identified, took a really long time, you know, and now to reconstruct all of those exposures prior to that time is going to be really critical.
Now, as I understand, there was a previous outbreak of this virus in Argentina in 2018. Officials there believe that the first cases now may have been contracted on a bird watching trip in Argentina's south. Now, I just want to play something that the WHO had to say earlier today, and we'll come back to you, Anne Rimoin, in a moment.
Mm-hmm. Does that mean the rest of the world, this disease will spread? We had that outbreak in 2018 and it led only 34 cases. We may have similar cases from there. So I just want to show that if we follow public health measures and the lessons we learned from Argentina is shared across all countries, what needs to happen in contact tracing, isolation, we can break this chain of transmission. And this doesn't need to be a large epidemic. It's in a specific confined setting where people are interacting in a prolonged close contact. So we feel it's quite familiar to the 2000 outbreak in Argentina, and we don't anticipate a large epidemic.
So not anticipating a large epidemic, and that sort of matches up with a lot of what you were saying, Anne Rimoin. What role does international cooperation play in a situation like this in outbreak tracing?
International coordination is critical here. It's going to be the centerpiece of how you're able to piece all of this together. Now, we're talking about multiple jurisdictions, multiple organizations, people having traveled globally now. So international coordination and collaboration is going to be key to be able to get all of the information together, to really understand it, and to prevent cases like this from happening in the future. You know, this is why you know, the WHO is so critical. This is why our own public health infrastructure is so critical, and really demonstrating that it's really important to have all of these things in place ahead of time. You know, I said this often during the pandemic. I'm going to say it again. It's much easier to stay out of trouble than it is to have to get out of trouble. And we always want to be in front of these things as opposed to chasing behind them. So having that infrastructure, and that includes global coordination and mechanisms for it in place before we run into these situations. Viruses are going to continue to spill over. You know, this is an unusual situation, but certainly these things can happen. And with increased travel and trade and climate changes and changes in how we interact with wildlife and exposures, you know, this is not the last time we're going to see this. So we should have really good coordination.
And we'll do our best to stay out of trouble. Thank you so much, Anne Rimoin, Professor of Epidemiology and Director of the Centre for Global Health Security at the UCLA School of Public Health. Thank you.
Thanks for having me.
And we'd love to hear your reactions and maybe whether Professor Rimoin's answers have changed how you're thinking about this. If you like this video, please hit that like button. And if you haven't already, don't forget to subscribe. Thanks for watching.